So I'm Becca. I'm one of the physical therapists here at Mercy. A little bit about me and my background. I'm an Atlanta native and have been in Cincinnati for about 4 years. I've been a physical therapist mostly with the neurological population. I spent a lot of time doing ICU and inpatient rehab. And then in the past year, have really been enjoying doing the outpatient side of things and not being just in the hospital, getting to see people for a little bit longer and develop that relationship.
My name is Allison. I'm also a physical therapist downstairs. I have been with Mercy for almost 14 years in this location. I specialize in neurological conditions as well as vestibular rehab, which is dizziness. So if you have any issues with vertigo or spinning, that's where I can come into play. I've received a lot of specialized certifications for that. But I also have treated, name it, I've treated it in the outpatient world in the last 14 years. So,
yeah. So we're glad you're here. We want to give you some general tips and tricks and also let you know about the resources that you have available to you here through the Healthplex and then through physical therapy specifically. So just a little bit about what we offer. There's 22 different locations throughout Cincinnati. If you're here, you're probably like me and live in this area. This is a picture of our clinic on the first floor of this building, but there are many spread around. One of the things I think makes us unique is we have one-on-one patient care. So we're really able to give you our full attention and not, here, go do this exercise while I pay attention to someone else. We have a lot of state-of-the-art equipment, and then Mercy really pushes us getting further certifications and specializations so that we can help you even more. Some of the equipment that we have, you'll see today we have this Biodex balance system. So something really high tech that can give us data and say in a more succinct way what I might be trying to explain. And here's just some of the other things that we have in physical therapy in general. Of course, we do a lot of balance and that kind of stuff. That's what we're talking about today. We also see people for, pre and post-op from surgeries or pelvic floor issues or lymphedema or, lots of different things covered across the region. So just talking about balance in general, talking about the ability to control the center of gravity over the base of support in a given sensory environment. Even distribution of weight to keep someone steady and upright. Okay. Some of those factors that can affect your balance, of course, are your muscles and joints. If you have weakness or significant arthritis, the inner ear or vestibular, if you have that dizziness or vertigo, or something going on in the nervous system, right? If there's been a stroke or MS, or even peripheral neuropathy, all of those can play a factor in how you perceive the world and how your body can keep its balance. Just some facts about falls. These are from the CDC. So balance starts to decrease around the age of 50. And 1 out of 5 falls causes serious injury. And then more than 95% of hip fractures are caused by falls. So we take preventing falls really seriously around here. It's estimated that there's about 3 million visits to the emergency room every year for falls, and about 800,000 of those are admitted. So we know it's a serious thing, and we're going to get into how to help prevent them next.
So moving into some risk factors for falls, Becca kind of already touched on some of them, but having some leg weakness, pain, improper footwear can all contribute to a higher risk of having a fall. Difficulties with walking or balance, if you've started kind of just walking differently than you used to, maybe shuffling your feet just a little bit, those things can actually start to degrade your balance over time. The more you do the shuffling, the less you use those reactions, and then therefore the less they're able to help you in the event of losing your balance. Vision issues that can span the gamut from just some blurriness, decreased acuity of vision, to some people deal with double vision. Some people lose some different amounts of eyesight, like peripheral fields cuts can occur, things like that. And then moving into like environmental dangers. Those are things like uneven steps, which in the Cincinnati area in our older homes, that is very, very common. Clutter within the home, throw rugs, those are a huge tripping hazard. So we try to tell people pick up as many rugs as you can help. But then some things that you might not think about, such as neuropathy, as Bekah mentioned, having dementia, can play a role, especially if you need a walker, but you don't think that you need, like you don't think to use it, and then all of a sudden you try to get up and you can't manage that. And then a big thing is medications. So most of our older people are on a significant number of medications, and many, many of those have a side effect of dizziness. And so if you have started a new med and you now have new dizziness, talk to your doctor, which is what I'm going to get into next, about whether or not that medication is the right one for you, because that's a huge risk factor to having falls. So moving into prevention of falls, step one, talk to your doctor. If your doctor knows that you're nervous about falling, they can start helping you get to the right people, which primarily is us. You can get a referral to physical therapy, but the doctors can also help to review your medications, check, make sure your blood pressure is stable, your blood sugar is stable. All of those things contribute to falling. And then getting into the physical therapy, starting to do some strength and balance exercises. As a physical therapist, we provide individualized exercise programs that work on strengthening your core, strengthening your leg muscles, working on those different balance reactions, which we can get into all kinds of details about. Primarily, we need to keep those reactions strong and quick. But the tricky part is to improve your balance. It has to be challenged, but it has to be challenged safely. We don't want to give you something that is going to then potentially lead to a fall. So we have to work on what is the right exercise for you. And then we can also help recommend whether or not you should use a cane or use a walker or using walking sticks if you don't want to go to the walker just yet. But if that fall risk is high enough that we think, we want you to stay safe and we want you to stay active and mobile in your community, this might help you to maintain your mobility. Otherwise, you might start to do that regression that I was talking about. Moving into prevention within your home, trip hazards are, removing the trip hazards are kind of the number one thing. If you have different areas of your home where the threshold might be slightly different, or if the flooring changes, sometimes there can be a little lip there, and that is an area where you could have a tendency to trip. Lighting is also extremely important. Vision is one of the main tiers of contributing to our balance. We have vision that contributes to our balance, our inner ear, which senses where the ground is, and the vision then says, yep, I agree, down is down. And then our body can then react to that. And so if we can't see where the ground is, then we have to rely on our body and our ear, and we start taking away some of our advantages. So getting up in the middle of the night is a common thing, going to the bathroom, and you don't want to turn the light on because you don't want to wake up your spouse. I get that. Have some little night lights all the way lighting your path all the way to the bathroom, because that can help you prevent that fall in the middle of the night. Grab bars in the bathroom. A lot of falls happen in the bathroom and on stairs. So if you have any steps at home that don't have handrails, we recommend trying to find somebody who will install them for you, and or within the shower, near the toilet. Using non-skid mats in the bathroom, those are the only ones I like. Don't like the throw rugs, but the non-skid mats in the bathroom are very important. A toilet seat raiser. It might not seem like a big deal, but every time we lower to the toilet and stand up from the toilet, we are changing our center of balance. And if you don't have to go quite as far, you're less likely to then land harder or miss. And then same thing when you go to get up. If you need all that momentum to get off of the toilet, you might throw that center of balance too far forward, and that can lead to a fall. So if you make it easier to get up and down from the toilet, that's one less thing you have to worry about. And then biggest thing, as you can see in that picture, is clutter. The more clutter in your home, the harder it is for you to rely on all of your awareness for your balance. A lot of people use their furniture to keep them upright, which is something that we really work hard on trying to get you to not do, because reaching for furniture takes that center of balance away from your feet and relies on a piece of furniture. And that furniture may be further than you think. It may not be as stable as you think, and it can lead, again, to falling. And if you have clutter, then on top of that countertop, that's an even bigger recipe for disaster. And then this kind of starts to segue us into fall prevention. It doesn't have to just come from physical therapy. It can also be within the HealthPlex setting, taking classes that keep your mobility up, keep your exercise moving. Because anytime you strengthen your legs and move your body, you are doing yourself some good. Getting your vision and hearing checked regularly. The CDC recommends getting your eyes checked annually. That might seem like a lot. Oh, my eyes haven't changed in 15 years. I don't need to go to the eye doctor. You might be surprised, and so it would be good to get them checked every year. The hearing is recommended to be checked every 3 years after the age of 50. And then some simple things, keeping your hands free. When you walk with lots of things in your hands, you have less help from those hands should you need them. Getting good sleep is important. It helps all of the systems of our body work better when we sleep. Wearing that non-slip footwear, and then decreasing caffeine and alcohol intake. Caffeine and alcohol both affect the neurotransmitters of the brain, and the brain is the center of our balance. So we want our brains to be as healthy and active as we can. So I'm going to hand it over to Emily.
Okay. Hi, I'm Emily. I am the Wellness Navigator here at the Mercy HealthPlex. I primarily run the MyFitRx program, which I will discuss here in just a little bit, but I'm also a personal trainer here. All right, just a little bit about the HealthPlex. So it's 150,000 square feet of fitness equipment. So we have our pool, we have our fitness floor, our basketball court, our spa even counts. So we have it all here. We offer everything for you guys. We are also a Medical Fitness Association certified facility. We're only the second one in Cincinnati, fourth in Ohio. We just recently got that about a month or two ago. We also offer a lot of group exercise classes. So it looks like 85 classes here, and a bunch of those are perfect to work on your balance. We have a balance and stability class, chair yoga, sit and strengthen. So if you guys are worried about standing up, and again, like they said, changing your balance, changing your center of gravity by holding some weights or anything, you can do it while sitting. So we can still work on your strength from a seated position. We also have a zero entry warm water pool. So if you're interested in getting in the pool to help work on your strength and balance that way by taking some of the pressure off your body, we have that available as well. We also have a bunch of personal trainers available outside of myself from my individualized program. Working with a personal trainer is going to help you get an individualized plan built for your needs. So if you're coming in specifically for balance, they're going to be able to meet those needs with very specific exercises for you guys. If you were already in physical therapy, we can help build off of their programs as well. And then lastly, MyFitRx here. This is the program that I run with the help of a few other personal trainers. It is a physician referral based program. So you'll need a referral from your physician or physical therapist, a PA, anybody that's willing to sign it when you go to the doctor and say, hey, these are my concerns. These are 10 of the pathways you can enter under. So if you're coming from pulmonary and cardiac rehab, you can have them sign it. From orthopedic, you can have your orthopedic surgeon or your doctor or your physical therapist sign it. The one most popular is our functional fitness one, which is if you were most concerned about your balance, you would enter under functional fitness, especially if you have arthritis, fibromyalgia, and then those are some of our inclusion and exclusion criteria. So primarily, we just need that referral from your physician. to get into the program, and then make sure we're meeting some other needs to help you meet your goals within that program as well. This is kind of the layout of MyFitRx. So in week 1, it's an 8-week long program. In week 1, you would get your pre-assessment, which is about a 30 to 45 minute assessment working on your muscular endurance, your strength, your balance specifically. And then we'll go into a health survey and we'll get your customized workout plan made for you. And within that first week, you already get 1 supervised session, an hour-long session. And then in that middle of that program, week 2 to 7, we're going to get 2 per week hour-long sessions with your individualized workout plan. So everyone in the program has their own plan. You will be working specifically on your needs. And then through that 8 weeks, you have full access to our facility. You're not limited to twice a week. You can come in and use the facility at your discretion whenever you feel like you want to try something new, take some exercise classes, get in the pool, come work on your program by yourself. If you feel comfortable, you have that at your full access. And then once we get to week 8, we'll finish up your supervised session and then do your post-assessment. So we're going to run through all the same assessments that we did in week 1 so we can see how you've progressed in this 8-week long program. And then at the end of the program, if you choose to stay with us and keep coming to the HealthPlex, we also offer a waived enrollment fee to join into membership.